In the session that we're talking about today, what we're trying to do is take a bit of a step back from RRE and from the program and settings-based work and really look at a systems-level approach to primary prevention and what the infrastructural architecture is required to support it. So, just to start us off, can I start by someone offering some ideas and suggestions about what those terms, system-level approach and prevention architecture, mean to you?
In reflecting on everything that's been said today, I'm just got a couple of key things that come to mind. I think the first one is no silos. And I think so many of our services still work very much in silo. I think we really need to be able to work across a broader system in terms of that connection that we have. And for those, which I'll probably explain a bit later about my background in terms of maternal and child health and rolling out the craft training for maternal and child health nurses in 2009, it was also about the fact that we use the analogy very much about a child's view and the child's journey. So we talk a lot about schools today, but of course the reality is that this conversation starts from birth, from pre-birth, and all the way obviously through to the other side. So I think also the other thing for me about when we talk about systems level approach is about sharing the responsibility and sharing the accountability. It's not just one service, it's not one expert, it's not one group, but it's all of us. And I think the other part of that question was around prevention architecture. And for me, I think the key things and just key words to think about for me would be around the importance of an evidence-informed, evidence-based. Critical is about workforce, and workforce is not just about having the right people, it's actually also about their readiness, their willingness and agreement to actually take on the journey. And it's also about what was mentioned earlier about having the backyard right. So workforce is critical in that. We need policy, we need funding, and we also need, which I want to talk a bit later about, the critical role of relationships at all levels.
Systems level thinking for us, and when I introduced that concept to sport, which is the foreign terminology for them, it was about describing how we engage, how we educate people to shift their attitudes and behaviours and their beliefs in the places where they live, where they learn, where they work, where they socialise and play. And I think there's an opportunity for multiple organisations as well as across industries to play a role in sharing those scarce resources. That's really critical. I think being able to measure common objectives and having a single outcome helps a lot so that we're actually channeling those scarce resources to the outcomes and the impacts. And some of those things could include direct participation programs, organisational development, including building capacity, communications and marketing, as well as advocacy with a view of preventing violence against women rather than treating the issue.
I guess I've taken a bit more of a literal approach to the question, and I guess I was just thinking from my own experience in prevention, and I think the evidence clearly shows that ad hoc or single interventions in prevention don't work. You know, you've got to work in multiple spaces, you've got to work across multiple systems, etc. So, and I guess the other thing is we need universal approaches, we need more focused efforts. So I guess I thought about it in the whole, you know, I guess I thought about it in this way, being a systemic approach to addressing prevention. And I guess it's what is it that allows us to address both structural, systemic discrimination in the one sense, and then at the same time, how can we address individual attitudes and behaviours and beliefs? So all of that for me is how I think of a systems level approach. And then I guess if I think about architecture on top of that, I guess what is it that allows us to do all of this in a coordinated way? So I guess the systems levels approach is how do we work across, you know, multiple sectors in multiple groups, but at the same time, how do we coordinate? How do we get comparative evaluation outcomes and learn and build upon all of that? And I think it's the architecture that allows us to, I guess, perpetuate all of those findings, etc.
And being last on the afternoon, I actually agree with all of that. I think that I take probably a same but different sort of approach, and if you actually have a look at some of the origins of individual organisational and systemic interventions, the systemic interventions are those that basically address the cultural norms and the social and economic norms that produce either problems or work against them. So they don't work at the individual level and they don't work at the organisational level, they get right to the knell of the problem. So without a systemic approach, we're never going to actually end up with the aspirations that we actually need or want. And then I think about multiple systems. We have an education system, a legal system, a policing system, a whole range of all these different siloed sort of systems that constitute who we are and how we get up to go to work and school and get educated and play. So all of those are systems. Now, in terms of a PVOR architecture, how I think about that is all these systems actually need to be trucking along the same railroad. They need to have the same conceptual frameworks. They need to have the same monitoring and evaluation tools. They need to be informed by good evidence, and they need skill and capacity building to be able to deliver. And also, I think importantly in this climate, they need an architecture which is going to be sustainable in the long term to bring around that change, because that's going to take 20, 30, 40, 50, 60 years. And most people in the room won't be here by then, but we hopefully will have got that train nearly at the depot. So I think about the architecture as also needing to be able to be smart enough to sustain the political change and fortitude that's required to keep on doing this work.
Yeah, I think it's a term that we throw around a lot, and so we just wanted to do a bit of a, kind of a shared articulation of what it is we're talking about and where we're trying to get to. So, Tania, prevention work has historically been led and implemented by the community sector, and we're now seeing government take a much more active role in this space. Can you talk to us about what the roles of government and the community sector are and how each of these kind of sectors or organisations can work together?
I don't know if I'm going to give you much satisfaction on this answer, but I guess for me it's easier to start from the community sector, I guess. I've always looked at it from this perspective. I think that's where the grassroots expertise really develops and grows. And I think that's where we see a lot of catalytic and innovative programs emerge, and therefore, and we've seen that definitely in the prevention sector amongst many others. I think, so if we accept that as the basis, I think moving from there, I think the role of government can be to take these successful and catalytic and innovative programs and really allow for them to be scaled up broadly, and I guess government has structures and systems that allows that to happen, as well as funding, of course, to enable those things to happen. So I guess in a way I think of it as like, I don't know if this is the right term, but like a symbiotic relationship. You can't really have, you can have one without the other. The grassroots will always continue to work, but I guess if we really want to scale up and we really want to move, and get this spread out across, like Lynn was saying, multiple systems, multiple groups, etc., there really needs to be some work by government, especially where it has the levers to make change.
Well, that's a very lovely segue into the next question, which is about, what happens in those areas where government doesn't have those levers to make change, where they've got less oversight. Cam, can you talk about what approach in those settings, given you're working in one of those, what approach is needed to make sure in settings where there's not government oversight, where there's a kind of an impetus to pick up and carry on that work?
So I will canvass the fact that I think there's two sides to the value of sport. So there's the romantic notion that I think can be played out through the media, through government, through community level sport and active recreation, which highlights the role model, the creating the awareness of what can be. And I think the emergence of, it's only taken 200 years for the AFL to cotton on, but you can see the fact that they've identified that AFLW as a product is a growth opportunity for the game. So I think what it can do there is it can create awareness, it can inspire people, and it can do really good things to actually start to get people moving in the right direction. On the flip side of that coin, sport also can create unhealthy attitudes and behaviours and beliefs. So I think I'm putting it out there, recognising that the value of sport is, and it's well evidenced, stronger than what it is limiting. But we do need to also be thinking that through. Sport's also very similar to government in that it's got a federated model. So a national sporting organisation like the AFL works with clubs and state bodies and local levels. That's not always coordinated. So there's some real challenges that are created by that federated model. For sport to be really effective, it needs to work together. And by that, I also mean across different codes. I think that sports are seeing the opportunity in doing that, certainly at the national and the state level. Locally, sports can be a little bit isolated and siloed, so I think there's some real challenges there in taking a systems approach for sport to be able to create effective change. In North Melbourne, we've been a real leader, and I don't think it's come about as a result of any crisis, but that can be a lever to pull to actually help just start to shift changes in attitudes and behaviours. The AFL have had some pretty public examples of that, and that has been a trigger for them to be able to think through what policies do we need to be aware of, what training and education do we need to get on top of, how can we be a leader in this industry. At North Melbourne, we've worked really hard with the experts that sit outside of our industry, people like you, to be able to come and create that awareness, but importantly, take the work of and the evidence and actually start to put that into an effective plan that we build our own capacity internally to shift those attitudes, behaviours and beliefs so that we can create safe, inclusive and welcoming environments at the local level.
Great, thanks Cam. When we're talking about prevention, we are talking about an incredibly long-term journey. We are talking about significant social change in the long term, and it really doesn't happen quickly. You can often feel like you're banging your head against a brick wall. But at the moment, what we're seeing in Victoria is major reform, significant funding, and a radical pace of change that is completely unprecedented in the 10, 12, 15-year-old prevention sector. Lynn and Cam, from your different perspectives, can you talk to us about how important it is, whether you're a government or setting a strategy or whether you're implementing a program within a community sector, how important it is to take a staged approach to this work, and what does that staged approach look like so you don't burn yourselves out and so you achieve the change you want to?
I'll do the next.
I can't think about going forward unless I think about where we've been. And sorry, I was just saying I can't think about going forward unless I actually think about where we've been. And I suppose I was just reflecting with one of the panel speakers this morning, and we were just talking about how it wasn't until 1975 that we actually had the first. There you go. We had the first women's refuge in Victoria. And when you think about that, that seems like a long time ago, but when you actually get older, that's nothing. It's sort of like a minute away. And people that are sort of over 50 in the room will get that. So I think that basically you've got to say, well, the women's movement actually struggled really hard and long in this state and across the country and globally to actually have the position of violence against women even put on the agenda. And it wasn't really until the Women's Health Services actually started to lobby very hard in this state that we ended up creating what I think was probably one of the first vehicles for getting the prevention of violence against women up on the agenda, and that was proving to government that basically we have a huge problem in terms of prevalence and incidence of violence against women. The burden disease study indicated its impact, and so that got front page of The Age, and it ran internationally for almost 6 months. And we also had the population surveys, which we'll be able to monitor over time. We then saw, so the role of research in saying, okay, what's the problem, what's the size of the problem, and is it preventable was really important. So all of the researchers really contribute in that very early days on the back of the women's movement to actually get the agenda up. Then I think that you saw some cataclysmic sort of alignment of the stars in that Christine Nixon was in Victoria Police as the Commissioner. Rob Moody was at Vic Health, and he was always a supporter of social justice and human rights. But at the same time as internal staff were actually trying to get a focus on prevention of violence against women up, one of his best friends murdered his wife. So he had this inherent sense of justice and this incredibly confronting personal experience in his backyard, and he said, right, it's on. At the same time, the AFL were starting to lose women walking out the back door of the clubs, which are basically the mainstay of clubs, because they were no longer prepared to basically buy tickets or walk into an environment which was basically alienating of them. So from a corporate perspective and from a legal perspective, the AFL knew that they had a problem that they needed to manage. Thus, Andrea Demetriou put up his hand. And I remember being at a forum once with this wonderful human rights activist, Di Otto, and she got up and she said, well, I never thought I'd see the day where I was talking about the prevention of violence against women with two blokes and a copper. And along the panel were Christine Nixon, Rob Moody and Andrea Demetriou, and they really pressed the prevention agenda on the back of the science and used their legitimate authority to basically open doors. So what you then saw was people like Rachel Green and others in bureaucracy that had done the hard yards for 10 or 15 years, pushing this agenda, and they had fertile ground, and you started to get a political momentum. At the same time as that, money started to flow out of Vic Health and out of the state to start to really seed and trial and build and grow some of this work across the state. So you actually saw people like everyone in this room that were actively committed and engaged and were leading work in their own backyards. Then I suppose the other star that was in alignment is that a now Premier was also the health minister at the time that all of this momentum was taking place. And he was convinced that the burden of disease was real and that there was a role of the health system and other systems to actually play a leading role. So I think it was with some embarrassment at a Vic Health Awards dinner one night, it's something like 18 of the projects that received awards, 16 were prevention of violence against women projects, and there was a tobacco and alcohol one in there somewhere. So it was really, and he was there presiding over it, and he spent the whole evening talking about this incredibly important issue. Well, here we are. The Premier is now the Premier. The Royal Commission has now stated its course. We've got the National Community Attitudes Survey, we've got the Population Public Health Survey, we've got the Personal Safety Survey, we've got a cast of thousands working in the department pushing out the Integrated Service System agenda. We've got money flowing into the system. Now that's taken about 20 years to get to the point where the money's actually flowing. So I think that some of the main things about that is building and growing incrementally, using the skill of researchers, practitioners, strategists, leaders. And I think it's really important that in terms of that staggered approach, we really need not to squabble about the crumbs. We've got to actually start squabbling about the bigger pictures and squabbling in private. Because the next course is going to be really, I think, quite complex in terms of how we actually manage the strategic directions moving forward. And there's a clear example of that in the integrated service system response and the rollout of all of those reforms. If we're not very careful, that money will be used to prop up other agendas. So we've got to keep vigilant in terms of how that rollout takes place. In the same way with the prevention of violence against women resources, we do, as cross-sectors, need to form some view about what architecture we actually all want moving forward, and what is the role of Respect Victoria, the new agency. And will that be given a mandate to actually carry this work forward as the leader of the architecture? So those are some of the things that I think are complex and omnipresent in the current environment. Having said that, I think it's really important about incremental change. I suppose I also hold the view, never miss an opportunity, because while some people say that opportunities will come and go, some don't. So I think this is a really good opportunity to grasp. It has to be grasped now. And I think we've got to stay smart and get smarter about how we actually use it to the advantage of women and children.
I should have gone first because my response is not going to be anywhere near as good as that.
Not as old as that cab when you were a boy.
I don't know if anyone heard that. I think Lynn's painted a really fantastic picture of the macro. My lived experience in the micro and working within the North Melbourne Football Club more specifically has been change is really, really essential. Language is critical. Introducing the concept of preventing violence against women through a football club, there was a lot of people that really just didn't understand it. So I think there's been a lot of great evidence and tools and resources and great communication materials that we've been able to leverage and to work in partnership with organisations like many that are in here today. We've also, I suppose, leveraged the media and the reporting of incidents that are close to home. So over the past 12 months, there's been some senior executives within the AFL whose power has been abused, with women, whether they be their family or their colleagues, have been disadvantaged. Similarly so, men of privilege exploiting women through images, etc. I don't have to go into detail. But that is a reminder back to us as an industry and as a club that this is completely unacceptable, and importantly that this is preventable. I remember about 2 years ago when this process had begun for us, and I had introduced the concept within our executive and our board. James Brayshaw, who was the then president of the club, was linked to an issue associated with a couple of high-profile media personalities, one being Eddie Maguire, the other being Tony Frawley, who highlighted some pretty ugly terminology when talking about Caroline Wilson and essentially drowning her. Our president was linked to that, but didn't say anything at the time. And for me, that was the moment that I used as the leverage to say the fact that he said nothing implied that he was involved. And it's completely unacceptable for a leader within our industry and for our club to be associated with that. Now is the time that we need to change. And so I use a crisis to actually gain and create change internally.
Panel, I'm going to give you a time warning, one of the first of many. We've got lots of questions to get through, so we might have to keep our answers short so we can get through everything and so you can all have an opportunity to engage as well. Thank you for explaining your questions, your answers so thoroughly though. It's a hard balance to strike when you're on a panel, I think, really making sure you're answering the question in the way that you need to. So one of the things I want to talk about now is the workforce, and I think we had a fantastic announcement from the Minister this morning about some new funding for DVRC, which is incredibly exciting, which is about building the capacity of the prevention workforce, not only through training, but through delivering communities of practice. Helen, you've had some kind of experience in this space, not necessarily in the prevention context, but in terms of figuring out how on earth you get a mainstream workforce to understand this issue. Can you talk from your experience about some of the things that you need to consider when you are building both organisational and workforce capacity when you're embedding something like prevention or family violence response into a system?
Yeah, certainly. Look, I'll just give it a little quick and brief, but in terms of that, so back in 2009, I was working for state government. The decision at that time was to roll out the Common Risk Assessment Framework across the MCH workforce across Victoria. That was around 1,100 maternal child health nurses. Maternal child health nurses are actually employed by 79 local government areas. Half their funding comes from the local government, half the funding comes from state government. And this was a state government initiative. So already you can imagine the difficulty and the challenge about actually trying to implement something at a state level, but you actually had to then engage the 79 local government areas. The key for me in terms of the workforce and bringing them on board with that was actually to ensure that there was key leadership around actually having the person leading that was actually a practitioner who knew the core work that these nurses did. I think the other thing to really understand with maternal child health nurses is that we're the only state in Australia where legislation ensures that after birth that every family is actually connected to a local government maternal child health service, which meant that obviously every newborn baby has actually got an opportunity to engage in the service with the family, and hence the reason why this platform was put there. I think the key thing in considering workforce stepping into family violence place, and every MCH nurse involved at the time would say that they had seen it, they were living it, but they just were now going to be asked to take that next step of actually discussing it and identifying it. And that's a really big move from going from actually having a gentle conversation. The evidence was strong about the importance of this work. The evidence was strong about the key of asking direct questions. And therefore, it was really important to actually put in place that evidence into a framework that actually articulated why it was important and how that actually this workforce could do it. So that was really, really an important part. And a very important part in the driver of change at this point was trying to find what it was that could make this workforce take this on apart from just the evidence. The key thing was actually the evidence around the impact on the child. So the actual impact on the child of family violence was the key driver of change at that point, and something that we leveraged really well. I think in terms of all of that too and that evidence, another critical thing with workforce and bringing this through was understanding a thing called constructs. So a framework that's a useful framework to use is family partnership, but the key with this is about that when you're starting to talk about these sort of real important social issues, it's not only what the family are experiencing, it's actually the practitioner themselves has to understand what their own experiences and how that's actually informing how they engage with the family. This particular service, the critical component in this service is relationship building, and it's the trust that comes. And to develop that trust, it's got to be an understanding of not only where the family's at, but also where the practitioner is. So a lot of work needed to be done about always continuing to reflect on the own workforce's constructs and how they actually articulated the messages they were. Another really important part about all this work around the workforce and bringing this change, which sometimes gets missed, and it did get missed at the beginning, was around the importance of supervision. So we talk about the importance of caring for the family in these circumstances, but it's also about the staff. So workforce supervision, reflective practice are critical parts of actually this work. And the other evolving thing from all of this, which took time to actually evolve, was understanding that we were prioritising the safety of children and women at this point. We actually, down the track, had to realise that we had to also prioritise the safety of the workforce. Maternal child health nurses, even though most of them are now working not in isolation, are often actually sitting in isolation in consultation with families when family violence is divulged. And the other key thing that's happened in maternal child health in the last 10 years is that now with this conversation that is a continuing conversation around family violence, is that we're actually often sought as a place of refuge. So all of a sudden a family may present, someone wanting to present to escape a situation they're in. And I think also then too, which I'll probably, is that enough for probably what you want for that? Was there two parts to that question, was there, or?
Were really about embedding at a system
and I think then
level,
the system in terms of organisation. So that's the workforce and addressing the workforce. It's then also realising that wherever we're working, wherever we're being, we're actually connecting with so many other organisations with the community constantly. So the work that you do in this field and in this framework was not just about educating a workforce about how to ask critical questions. It was also about involving the whole organisation, from the librarian, from the receptionist, from the police station down the road. The key with all this work was actually to engage at all levels with all services. And I think the final thing about that I wanted to key too is it was really interesting in reflection on this, because the reality with this particular work that happened in 2009 is the initial focus was purely on identifying family violence. It actually wasn't on prevention. The work around prevention is actually what has followed, but it certainly wasn't the key thing at that time. The workforce, as you can imagine, were very challenged to be placed in a position where they were expected to follow a framework that, even though if you asked them casually would they do it, they would say they would, but when you formalise something, that was more of a challenge in terms of how to do it. And I would hate to have to tell you how many times I would have a nurse say to me that once they became confident in asking these questions, that they'd be having conversations with a mother who was having their third child, who they had seen through the journey of the other two children, but for the very first time was actually saying to this nurse, yes, I am experiencing family violence. when the nurse asked why they'd never asked that before, had divulged that before, the comment was, "You never had asked me." The power of that was very critical in terms of then driving this workforce to continue the work. And this workforce is very much in the space now doing so much more around not just identifying but actually preventing.
Look, I think that frame around construct is a really critical point, because you can have all of the policies and procedures and funding and government regulations in the world, but until the individuals that you're talking about are willing to take that personal shift and then to take another professional shift, then really there's not much that we can do until we have those individuals on board in terms of that systemic change. So moving to the specialist prevention workforce, I think, I know that we've had a lot of conversation today about the importance of the community sector, the importance of specialisation, whether you're talking about prevention or response, and I think everyone's on board with the need for that. But as we mainstream primary prevention activities, there are a lot of groups and services that people come into contact with. Tania, can you talk to us a little bit about what we need to consider when we're talking about building the capacity of those other groups who we're, colloquially known as people contributors in the capability framework, to also promote prevention messages?
I guess for me it depends what you call mainstreaming. I guess when I think about mainstreaming, are we talking about expanding universal services more broadly across, efforts, in which case there are huge amounts of, I guess, what is the workforce? It's almost every sector that needs some level of capability or capacity. I guess from my perspective, and certainly from where I'm working now, I'd say that we were actually working or focusing more on more focused efforts with particular groups and communities. And I think in this sense, these could be groups or communities that don't always have access to or can be or are a part of these broader, universal efforts on primary prevention. So in particular at the moment, we're about to engage with in 3 metro locations and 2 regional rural locations with ethno-specific or migrant and refugee services to undertake specific primary prevention activities with groups or migrant and refugee community groups. But I guess if we look at those sectors, they are specialist in and of themselves in a particular thing, and that is that they're often the touchstone or the first point of contact for these communities, again, for a range of services. So what we're trying to do is partner these services up with primary prevention specialists to try and build the capacity in these organisations to help deliver some of these primary prevention initiatives out in the community, to ensure that we're getting even broader access to communities than we might do by just expanding to the workplace or, other sectors, sports and beyond. So I think it's partnerships like this, in addition to having the workforce capability, competence framework, etc. We need to do all of that, but I think it's also partnerships between different sectors that can really build the capacity on primary prevention, because you're really merging together 2 specialisations in a way, and 2 sectors are learning from each other, and I think that's really critical. So that's something we're sort of trying to work on at the moment now, sort of in parallel to some of the more formal upskilling I think that's taking place. So I don't know if that's answered.
Absolutely it does, yeah. Lynn, what are some of the key differences or challenges or opportunities that you face when you're designing prevention work that needs to be embedded across an entire system, as opposed to looking at a settings-based or a population-based approach?
So it's an architecture as opposed to a systems question.
Yes.
Yeah. Every system, and when I say systems, I'm talking about the education, the workplace, the sport, art, the local governments, you name it. We've talked a bit today about language. We've talked a bit today about maintaining a feminist gender lens. Without a consistent approach, a consistent language and a consistent framework to be introduced at a systems level, our work's always going to be fragmented. So I actually think the challenge of the PVOR architecture is to support and resource the frameworks, new evidence, workforce development and skill capacity to make sure that we're all still trucking, and I'm sorry to use the train line again, but we're still trucking along the same train line. And that sort of approach requires partnership and collaboration, as Tan was saying, at the local level, but also at a organisational level and a systems level. But you've got to have an agency or an organisation or a department that is actually committed to maintaining that integrity and driving it. And as one of the speakers on the panel said today, if we're not actually maintaining that integrity and driving it, and we're camouflaging what we're doing with watered down language, we may as well not bother, because we're actually doing something different to what we say we're doing. So for me, the challenge of that is to actually remain relatively constant in our advocacy around the development of an architecture that actually works.
I've got one final question before we jump to your questions and a bit of a conversation. Something that we heard a little bit about in the one-size-doesn't-fit-all session that was held after lunch was about the risk of watering down or losing the kind of key gendered framework, really, and the primary prevention messaging when you're incorporating this work into a mainstream context, when you're mainstreaming the work. Can each of you talk from your perspectives about what you think needs to happen to make sure that we maintain that the prevention integrity of the evidence base, but also maintain a gendered lens and an intersectional feminist lens when we're starting to mainstream this work?
I'll start. I think having worked both here and internationally, I think it's really important that if you test something and it works, you have to stay true to the methodology. If you are applying things in the context in which they have been tested and they continue to be so, I think evaluations are critical, and they, certainly in the international space, a lot of money is spent on evaluations precisely for this reason, so that they can be either expanded to other locations or they can be scaled up. And I think sticking to the evaluation, the outcomes, the methodology is really critical. I think as soon as we try and adjust them, when we roll them out more broadly, I think that's when you start seeing different outcomes. And it has an impact in the end, because you have to then kind of revisit things that you've worked on quite closely for a long time that have worked, and you're kind of going back to reinvent the wheel again as to why there were perhaps slight differences later on. And I think it's true around language as well. When we're talking about, if we're talking about violence against women, there's a good evidence base on violence against women. We should be true to that evidence base, and we know that there are a lot of gender drivers, gender inequality, certain expressions, other forms of discrimination compound, etc. If we're talking about broader forms of violence in terms of the family violence context, then we're still, I think, understanding what the evidence base is more broadly. But I think where we know, we need to stay true.
This is probably one of the biggest challenges that we certainly had over the last couple of years in introducing the notion that our sporting club, our workplace, and by extension that our community can actually help prevent violence against women. I remember in a really practical sense, it was November, I think 2016, we were working with Our Watch and asking questions of ourselves. So as part of the 16 Days of Activism, we put together an internal communications campaign that highlighted the facts, using the evidence to create an opportunity for awareness, with a view that would connect the heads and the hearts. We had a lot of varied responses to that campaign over the 16 days. I had some of my male colleagues come to me and say, just stop it, I've had enough of it. And it wasn't until I asked them and actually sat down with them and said, well, what bothers you? And there was one good example of this. There was a forum of which was the AFL was creating to promote and celebrate women's participation. Now, I went to our people and culture team and I said, as part of this 16 days of activism, I'd only like to promote that opportunity to go along to that event to the women. I want to create a discomfort within the workplace amongst our male colleagues. I want them to experience what it feels like to miss out. And sure enough, I had men come to me and say, I didn't get that opportunity to go to that forum, why not? And I said, well, I excluded you. How do you feel? And they said, I feel rubbish, and that's discrimination. It is discrimination, you're right. And here are all the other examples of discrimination that lead or stem from inequality amongst gender. And if we continue to follow that path, I was able to arrive at the point that this is a contributing factor to violence against women. And the moment you say that to people, the penny does drop, the light bulb moment goes off. But having the Our Watch framework, the Change the Story framework, has been really important for us. Having an independent person, other than myself, talk about this consistently, that has been the permeating factor. The other part I would say to that is having a really good organisational structure that supports and owns this beyond simply a people and culture group. We've got representatives from across the whole organisation that before the start of every one of our Gender Equality Action Group meetings, we're talking about mission moments. We're talking about the moments that we've seen or heard or done ourselves that is preventing violence against women. We're constantly reinforcing that now within our meetings, whereas 3 years ago, it wasn't even a topic.
I'm probably the only thing I would like to add, which this is not the answer, this is something I see as a dilemma. Critical to all of this is about value add, it is about seeing what our outcomes are, but it's also about connecting us all. And I don't have the answer for that yet, but I still believe that so much great organisational work and work is done in this field, but it's still very much not connecting. And how can we connect so that actually the evidence that informs and the evaluations we do will be much more valuable and tell much more the truer story of what we're doing?
Absolutely. So can I just get a show of hands as to how many burning questions are sitting out there versus how many are sitting on this iPad on my lap? If you have a question, can you just wave it? Yep. All right, okay. I'm just trying to gauge our time. So there's an interesting question that's popped up here. There's two that are related. One is relating to self-care, but I want to ask a question first, which has been suggested by someone, and that's to ask everyone, those who are working in the primary prevention space, not in response, but who are working in prevention, to put your hand up if you have ever felt unsafe in the practice of doing your work. Can we get a show of hands? A couple, okay. Which is not surprising, particularly not when your prevention work can often veer into some of the response-based stuff. One of the questions that has been asked by the audience is really about safety and self-care. So in the context of the scale and the pace of the reforms that are coming through at the moment, Helen, from your perspective, can you talk a little bit about how we keep self-care front and centre for professionals, but also how organisations can support the safety of workers?
Yeah, and I think there's a couple of parts to about that, and I'll give some analogies. So the last 5 years, I actually was a maternal child coordinator at a particular local government area. So very much by this stage, maternal child health nurses were very much comfortable in terms of identifying family violence and working with these families. So that's the other really critical thing in that particular field, is it's not a one-off interaction with a family. You're building a relationship. This family continued to come into this service and engage with the service. So we would have, I don't want to tell you how many, but quite a few circumstances where both partners would come to a visit, and it was really quite obvious that neither the practitioner actually or the mother were feeling quite safe about where they were. It brought a couple of things to fruition. First of all, we can do a lot about actually ensuring the workplace is a bit safer by not allowing practitioners to be isolated. The second thing I think it brought the challenge up for me was actually challenging back on the workforce about really being able to identify what it is their role is. And I think sometimes in terms of some of these practitioners in maternal child health is about, should they really be case managing family violence circumstances, and should they actually be referring these families? The key issue when we talk about referral, which actually hasn't come up really, but I think is critical, is that someone would say, well, there's family violence, just refer them off to that specialist. That's not as easy as it sounds when you're working in a universal service like maternal child health, where this particular family have developed a trust, they've got the ability to actually, in freedom, to come to a centre. but they don't actually have that freedom or ability to actually connect with another service unless that service can come to them, to the actual maternal child health service. So when we're talking about safety for our workforce, we were doing a lot of work of actually bringing those referral options, those other areas that could be supporting these families, actually to a maternal child health centre. The practitioners, in terms of their safety, I think number one is also around them understanding their role, being challenged about their role and being able to actually attend supervision and reflective practice to actually unpack that is really critical. And the other thing that devolves, which I think we need to be very aware, is that it does bring up their own personal experiences too. I talked to you earlier about constructs. It's something that really is quite critical. So how you engage with a family is very much impacted by what has happened to you in your past too. So the workforce in maternal child health, that's a lot of work that we've done to do that, and I think it's really critical. I've moved across to an area now at QEC where I've got staff that are going out to very, very interesting circumstances at times. But again, about safety, it's about them actually understanding what it is their role is and actually putting processes in place to protect them like that. But I can't underestimate actually the well-being side of the work, which is really important in any organisation. And that was another challenge that I had, is I actually had to advocate at a higher level to get funding for my workforce to have supervision and reflective practice. So when we talk about, and that was key into that, was about providing the evidence around that.
Thank you. So there's a couple of questions in my my knowledge of my own poor ability to manage time. I have over-managed our time, and so we've actually got a bit more time than we were expecting to have, or than I was expecting us to have. And there's a few questions coming up on the through the thing whose name I've forgotten, whatever is sitting on the iPad, is around response. And we did have a question about response, so I'm going to ask that now. Lynn, can you talk to us about what some of the key response to our family violence elements that need to be embedded in any statewide approach to primary prevention of violence against women?
I think that'd be documented in the capability framework, Emily.
They will be.
For people that don't know what that's about, basically it's Tan referred to it before. It's she was referring to the prevention competency framework for the state. There's also a response competency framework that's now called capability framework, and it'll have a range of iterations. But basically what it does is talk about the baseline foundation knowledge and competencies that people need to have across a range of service systems and levels. And with the baseline responding to, if you're in a mainstream sort of universal environment, like if you're working at North Melbourne Footy Club, and someone comes to you and is sounding like they're having stress at home, and you actually discover through the process that they're actually a victim of criminal assault in the home, then basically you, what do? You respond appropriately, support complete blanket belief, establish a trust, find out enough information to see if there's any ongoing risk concerns, secondary consultation with a specialist in terms of what are the choice and options available, and then hook that person into a service system. I know that's easier said than done, and if you happen to be CALD, it's near impossible. So, but that's the training, and those are the competencies. So that's basically the fundamentals, and most people sitting here would have gone through risk assessment management training, and if you haven't, then you'll probably be mandated to do it shortly. But so that's the general gist of it. Did I miss anything?
I was just going to say it's interesting. I work both in response and prevention, and I think given the high rates of prevalence there is no way you can do primary prevention work without having a good response system in place, because inevitably someone is going to have experienced violence, and there's going to need to be some efforts, to be able to get that person the right service response. The project that I referred to that we were doing before with the migrant refugee communities, it's primarily focused on primary prevention, but inevitably we have to build the capability around response too, because for sure there's going to be women there or men participating in this process who've either, men who may have perpetrated, women who may have experienced, and so we're going to have to be able to manage that in that primary prevention effort. So until we have no violence, there's no option, I think, but to have the two systems running in parallel.
I've got a couple more questions here. We might take a few questions from the floor just to give you all an opportunity. Can people pop their hand up so our roving mics can find you? Yes, we've got one up the back with Helen. If you just want to say your name and where you're from before you ask your question, that'd be great.
Yeah, so my name's Andrea Penrose. I'm a Respect for Relationships project lead from Inner Gippsland. And my question's for you, Cam. So as an Essendon supporter, I'm not overly enamoured with Caroline Wilson. However, I'm referring to an article that she wrote on the 11th of May in The Age about where have all the women coaches gone in AFLW. And in all honesty, reading that article, I actually felt quite gutted about where we've come to, thinking that we really were moving in a great direction, and to see where we're at. And in particular, I'm referring to a quote from Samantha Lane in Caroline Wilson's article. And it says, "I fear that the AFLW is starting to become a man's world in terms of leadership. I fear we've created a women's competition for women to play in and men to manage. Given your role at North Melbourne and your little bio here, how do you respond to that, and what do we need to do?"
Oh, it's a great question, and it's a really important one that we can address quickly. I know that the AFL, and I'll come back to the club, I know the AFL have identified that there is such a big gap in women's participation off the field. So they are actually putting resources. I think Nicole Livingston is now the CEO of AFLW. That's one of her key priorities. She's also working with Dr. Bridie O'Donnell from the Office for Women in Sport and Recreation here in Victoria, and they've identified that as a massive gap. And it's not just within the AFL industry. I think if you look across all sport, I was over at Moderator, which is a local football club, about an hour, 20 minutes north of Geelong on the weekend, and they had a male netball coach. And it's quite interesting, again, that why men are assuming these positions of influence and decision-making. At the North Melbourne Footy Club, we've identified that we have to get better across having women in decision-making across every part of our business. So we've got one female board member, and that's just not good enough. 12 months ago, we had one female exec. Now that's 3. So the tides are turning. We had the first female in our football department 20 years ago. Now we've got the highest concentration of women in our football department. We have appointed a male coach, but that wasn't based on anything other than the coach, the football department saying he was best for the role. But there are plans in place now to ensure that he's got successions in place with our VFL equivalent that are women. So the succession plans that are in place from our CEO all the way through down to our most junior staff, with a mandate that over the next 5 years we'll have 40% of women, and it's aligning with the state government's prevention of violence against women plan as well, to ensure that the women are in those roles and supported in those roles, more importantly.
I'm so glad someone asked a question about AFLW. Have we got other questions about AFL, women's footy, soccer, hockey, whatever? One up the back? Or respect for relationships or prevention, whatever you choose.
Hi, my name's Liz Orr and I work with Penrose. Fantastic presentation. Always great to see things moving ahead, and from a national perspective I want to reinforce what you're saying about where Victoria is at. But I would also like to ask, What do we do if we don't get the Andrews government next time? Who's doing the work, bipartisan work? Is someone doing the bipartisan work?
Who wants to take that one?
I'm sure there's a range of people doing bipartisan work. I suppose the major concern that I have are people doing bipartisan work to make sure that their own programs are sustained, or are they doing bigger picture bipartisan work? And I don't know the answer to the latter, but I'm sure the former is taking place.
It absolutely is, and I can second that. There's lots of CEOs and board chairs who are having conversations with a range of shadow ministers, but I think it's, we've got to remember that this is a journey. This was a journey for the Labor government. It's definitely going to be a journey for the Liberal government, and I think we can just cross our fingers hoping that whoever's getting in, the very least that they're going to do is make sure that they're committing to implement all those 227 recommendations of the Royal Commission, because I think we've progressed too far for any government to take, or I hope we have, to take a step back from that.
Could I just also add, one of the reason why I sort of bang on about the importance of the National Community Attitudes Survey is that that's our report card, and I know that you share an office with that machine, so that you would be very familiar with that, and the reason why the first state plan got over the line is, with a briefing with Rob Holes, we were able to say that the National Community Survey indicates that 97% it was a state survey at the time, Victorian survey, 97% of Victorians say that they want a government to spend money on the prevention of violence against women. So in order to be able to, if we're not briefing politicians, if we're still doing our job in terms of keeping constituent momentum and awareness up, by proxy, the people do vote, and the politicians know that. So I hope that we've got far enough so that there's no major backlash or pushback. And the National Community Attitude Survey is about to report. Is it reporting soon, Lizzie? Do you know? Yeah. So they're about to report soon, so it'll be really interesting to see how all the states line up, and whether we can actually say with pride, yes, we're getting there, or we've still got a fair way to go, and that's okay.
So I just want to go back to a question that's just popped up, which is about, part of the conversation again, and I know it's been happening a lot, which is about an intersectional framework. And so the question is that for some, gender inequality is only part of the story of violence and discrimination. How is it that we can meaningfully include those who aren't cisgender, who aren't white, who aren't straight, able-bodied? How do we go about including those people in prevention work? Does anyone want to answer that question?
It's complicated, this question, I guess. I mean, if you look at violence against women in any community, I feel like gender inequality is a strong driver, but compounding that for some communities are many other forms of discrimination. I guess when we're looking at other forms of interpersonal violence or violence in the context of families that may not be in what we consider violence against women, I think it's really important to work with those communities to really understand the evidence base. And I know that just before I left Office for Women, we commissioned some work around understanding drivers in LGBTI communities, for example, and I think that work has finished or is almost finalised, and that was sort of just the start of working with those communities to better understand perhaps what are some of the other things that are driving, like some of not being the only story. What is the story and what is driving it? So, and I think it's the same for, I guess, when we work with, for example, migrant refugee women. I mean, there is a gender issue there, but there's other power imbalances, so they're further and further away from where the centre or the power lies, because of forms racial discrimination due to their visa category. I mean, there's a whole range of things that impacts on women. I mean, Yeah, I mean, I won't speak on behalf of Aboriginal women, but there's, that's also, an area that's, significant and, is warranting its own area of work, and ANROs are doing a whole lot of work around that too. So I guess it's not a very satisfying answer, but I think we need to understand more, but not in isolation, with the communities. And I think that's traditionally probably hasn't happened as well as it could have happened.
I've got one more question from here before I ask you all for your final thoughts. This question has come with 2 hashtags, which I just think is absolutely excellent. And it's a really, really good kind of positive question for us to be the second last one. So, systemically, how can we get the right leadership working together to keep the keel strongly in the water during the time of this rapid change? And the hashtag is legacy and hashtag wise heads, which I just think is great. Who wants to have a go?
It's a terrible thing to say, but I actually think and it goes back to a point that was made earlier about relationships. And I actually think that the way to form solid working relationships is to have them. So it's not rocket science. And if you look at any sort of social movement or any political movement, they're based on relationship and amalgamations and collaborations and partnerships, and they're based on deals and based on compromise, and I think that's the only way to do it. So, and I suspect that that sort of activity takes place a lot. One of the problems, though, is that people, I think, can get actually entrenched in turf and history. So sometimes it's very difficult to get out of that mode. And if you listen to a lot of the sort of the leaders in organisations, or the ones that just sit directly underneath them, they will say, well, there's actually at the workforce level we have great relationships. We work really well. It's only the next level up, the leadership, that actually fight all the time. So, and that is actually a real problem. So I don't know whether there's an informal mechanism that needs to be developed during this period to actually bring some of the really key stakeholders together to start to form a proper alliance, which is inclusive and it's not owned by anybody.
In the most simplistic way you can and in the shortest way that you can each of you give our audience what are the 2 most important, the 2 top pieces of advice you would give to people tasked with designing a mainstream prevention initiative or implementing a mainstream prevention initiative? What are those top 2 things that they have to keep front of mind?
I think one of the things that really stood out to us when designing our gender equality action plan was to refer back to our own values in the organisation. So North Melbourne has 4 key values that are real, bold, never beaten and belonging. The word real was actually the catalyst for the conversation to start, because we knew that there was we knew that our men had to be real in the conversations that they had with their women and with their partners to address the change. So that was really important, and it lives long beyond simply a framework, and it lives long beyond simply myself, helping to lead this work. The other important one, I think, and it was another male colleague who works within the preventive space that gave me this advice, and it is drink lots and lots of coffee. And I don't drink coffee, but what he was actually referring to there is this is hard work, and you've got to understand that from the outset. But make the time to spend the time with people from within and without your organisation. And every time you have a conversation, you take the time to listen to where they're starting from, and understand the triggers that they're going to create that opportunity to connect their heads, their hearts and their hands. Sounds a bit cliche, but start from where they are and build from there.
Who next?
I've just got 2 things: evidence and evaluation when it comes to prevention. They are the key. They are king, queen, whatever you want to call it, because you need to be able to sell the story. Having done it both with international donors, having done it at the state level, they're the 2 things I'd come back to.
Well, I think we've already talked about relationship that came up, but I think communication is critical, and connection. And I think too is about having a voice for everyone. So that's the communication part. So voice of us as we're planning this work in organisations, but having the voice of the family or whoever is involved too is really critical.
Helen.
Use the evidence and evaluation knowing you're going to have to put on a black suit to make any sense of it with the powers that be to actually do anything about it.
Evidence translation. Thank you all so much. My head is full and spinning, and I've only been here for the morning and the afternoon, so you all must be completely exhausted. Can I ask you to thank our panel who, between them have got hundreds of years of knowledge. Thank you so much.